Many patients complain of a congested nose, which is really the sensation where you just can't take a full breath through your nose. And it tends to lead to sleep problems and exercise problems, and a lot of patients just want to breathe better through their nose. Well, traditionally, the only way to get patients there was with allergy medicine, including antihistamines or nasal steroid sprays. And if that didn't work, we would recommend surgery. Often the surgery would be a septoplasty or straightening out the septum, as well as a turbinate reduction or gently shrinking the size of the turbinates. Now there is a new procedure, a non-surgical procedure called Vivaer. Vivaer uses radiofrequency, low heat energy to gently shrink some of the swollen tissue inside the nose and also reshape some of the distorted cartilage inside the nasal cavity. This can dramatically help improve patients' breathing through their nostrils. The Vivaer procedure is done here in clinic with the patient wide awake. It does not require a general anesthesia. I do spend several minutes gently numbing up the patient's nose with the intent that they don't really feel much of anything during the procedure. And it takes about 15 minutes to slowly numb up the nasal cavity. There are no incisions during this procedure, and I use it to shrink the head of the inferior turbinate, to shrink the swollen septal swell bodies, and also to reshape the nasal valve, which is often the tightest spot inside the nose and causes the most constriction with nasal breathing. Pain is minimal with this procedure simply because I take a lot of time to gently numb up the nose. There are no incisions, so there is very little, if any, bleeding during this procedure. Most patients will go back to work the following day. Over 95% of patients feel that their nasal breathing improves after this procedure, and most of those patients, their sleep quality also improves. On average, the research shows that patients experience about a 50% improvement in the breathing through their nose after this procedure. Occasionally, patients will feel a little sting from the numbing medicine or a little bit of heat during the procedure, as it is reshaping the structures inside the nose. This is usually fairly mild. Patients will also experience swelling of the tissue inside the nose for a week or two after the procedure, and it does give you the feeling that almost you have a cold or a stuffy nose for a week or two until the swelling starts to go down and the patient starts to breathe a lot better. The Vivaer procedure is great for many patients with a congested nose that don't get better with medical therapy, especially patients who have improved nasal breathing if they pull their nostrils apart gently and take a deep breath, or for those who use a spray or two of Afrin nasal decongestant spray. If that is helpful, both of those can be predictors that the Vivaer procedure is going to help that patient out. Fortunately, most of my patients who have the Vivaer procedure are extremely happy with their nasal breathing and really have a fantastic result. And it's a lot of fun just to see how well they do before and after this relatively simple procedure.